I'm going to talk about the surgery of transplantation, the recovery process, and possible complication around the time of transplantation. Upon your admission for transplantation, you'll be seen by a doctor of the transplant team who will assess you and obtain consent for surgery. You will have your blood taken for testing, will have a chest x-ray and an ECG. You may require dialysis before transplantation. You will also be seen by an anesthetist on the ward. You will be instructed not to eat or drink anything until your surgery. Once in the operating theater, the anesthetist will put you to sleep. You will have a tube line placed in your neck vein and also a needle in your arm to give you fluids. You will also have a catheter in your bladder to monitor your urine output. You will then be positioned on the table in preparation for surgery. Sometimes it may be up to an hour before the start of actual surgery. The operation of renal transplant is performed through a 15 to 20 centimeter cut just above your groin crease. The surgeon on the day will decide which side your kidney will be placed. The blood vessels needed for transplant are the ones which take blood to and from your leg and pelvis. Renal transplantation is a straightforward operation. Once your blood vessels are prepared, the kidney is taken out of the box. The vein of the kidney is joined to your own vein first. Next, the artery is joined to your own artery. Once the blood vessels are joined, the surgeon will take off the clamp to allow your own blood to flow through the kidney. Often, the urine can be seen flowing out of the kidney once the blood flow is established. Once the surgeon is happy with everything, he will join the ureter, which is the urine tube, to your bladder to complete the operation. Your wound then will be closed with the stitches running under your skin. Occasionally, you will have metal clips to close your skin. 1 or 2 drainage tubes will be placed inside the wound to allow any fluid to drain out. After your surgery, you will be taken to a recovery area in the operating theater. Here you will stay for 1 to 2 hours until the nurses are happy for you to return to the ward. The duration of your hospital stay varies according to the type of transplantation. On an average, it is 1 week for a living donor transplantation and about 10 to 14 days for a deceased donor transplantation. Part of this time is taken for physical recovery from the surgery and part to fine-tune your kidney function and the medication. You will be given a push-button control for your pain relief for first 48 to 72 hours, after which you will be started on tablets for the pain. You'll be allowed to take sips of fluid and drink soon after the operation and may be allowed a light snack within 24 hours after surgery. This is in addition to the drip, which is expected to continue for 2 to 3 days. You will be expected to sit out of your bed after 24 hours and take a walk on the 3rd or the 4th day. The drainage tubes will be removed after 24 to 48 hours and your catheter will be removed after 5 days. You'll be started on anti-rejection medication following your transplantation. In addition, you will also receive antibiotics to prevent infection following the operation. You will not have completely recovered at the time of discharge from the hospital. You will require pain relief well into the 2nd week after your transplantation. You will also require more rest than usual. We advise you to remain active in between the periods of rest. Most people start feeling back to normal towards the end of the 2nd week. Return to physical activity, exercise, driving, and return to work are dependent on many factors, such as speed of recovery of renal function and absence of any problems. Work requiring intense physical activity may require more prolonged recovery period, sometimes up to 2 to 3 months. We advise you to ease back into your job by doing fewer hours at first or altering the nature of your job. We can't advise you of a start date for driving, but a sensible approach will be to have a few short drives first to assess. You should not be requiring strong painkillers and should feel confident to apply emergency brake should you need to. Your follow-up will be intense in the first month with clinic visits and blood tests 3 times a week. This will ease following the first month as the function of your kidney stabilizes.